What's going on, guys? Tony Maritato here, and I want to talk about the difference between a supplemental secondary insurance versus a non-supplemental secondary insurance, specifically related to Medicare Part B. So if you're new to being contracted with Medicare Part B, or you're a physical therapist, occupational therapist, or speech language pathologist, and you're thinking about it, I want to answer two of the most common questions related to secondary. So the first question is, if I'm contracted with Medicare as a Part B provider, will the secondary pay me, or do I have to contract with the secondary individually? So if it's a supplemental secondary insurance plan, a supplemental is an insurance plan in the secondary position that can only be sold to Medicare Part B beneficiaries, and they will treat you, that insurance plan will treat you just like you're contracted with them, as long as you're contracted with Medicare Part B. So that is specifically called a supplemental, and supplementals go by plan letters. So you can have like a supplemental plan F, a supplemental plan G. There's a specific chart that will tell you what the supplemental will cover in the secondary position. But the most important thing for this video is, yes, the supplemental plan in the secondary position will pay you just like you're contracted with them, even if you're not contracted, as long as you are participating as a contracted provider with Medicare Part B. Now, a non-supplemental in the secondary position. The most common scenario for something like this is, let's pretend your patient is a Medicare Part B beneficiary, but the spouse of your patient is still working and has coverage through their employer. Maybe they have an Aetna or an Anthem Blue Cross or a Humana plan through the employer that's going to function as a secondary for your patient. That is not a supplemental plan. That is a standalone policy. And so in that case, you likely would have to be contracted with that secondary payer. If there are out-of-network coverage and you're not contracted with that secondary payer, then you would want to know what the out-of-network benefits are going to be. But a common scenario is, and we'll use some numbers to apply this. Let's say your patient, Medicare Part B beneficiary, receives a treatment. The treatment is adjusted down to an allowed amount of $127. And so in a normal supplemental secondary situation, the secondary would pick up the 20% that primary Medicare didn't pay. But when it's a non-supplemental, if the 20% coinsurance, and I should have picked an easier number, worked out to $28 or $32, if that non-supplemental secondary plan, say, had a $40 copay, the 20% coinsurance is actually less than the copay from the secondary plan. So the patient would still be responsible for the full 20% coinsurance that Medicare forwarded through. But the challenge is, a non-supplemental secondary may require that you be contracted in order for them to cover any of the 20% coinsurance that's not covered by Medicare as a primary. So just understand two situations. If it's a supplemental, and by far the majority of Medicare beneficiaries have a true supplemental, also known as a MediGap policy in the secondary position, they will treat you as if you're contracted, as long as you're contracted with Medicare. But if the secondary is a non-supplemental, it's a standalone policy, they will not necessarily treat you as if you're contracted if you're not contracted. Plus, those policies do tend to have their own deductibles, their own copays or coinsurance. And if the Medicare allowed amount, 20%, is less than the secondary's patient responsibility, the secondary is not going to pick up, because the patient would be responsible for that balance. I know it's clear as mud, but if you have more questions, post them in the comments associated with this video. Otherwise, I wish you the best, and I look forward to helping you on the next video.